Hey everybody, this is Travis Robbins. This is our Ask a PT segment. Today I'm here with Bryana. She's our clinical director up in Bethlehem. Most of you guys know her. So Bryana, the question that we got was from Deborah, and she's asking a question about getting up. Upon awakening, I'm wobbly, then my gait gradually becomes steady. So it gets better as the day goes on. She says, should I be concerned? Let's handle that one first. So if a patient came in and said that to you, what would you just tell them?
So, first off, it is always concerning when a patient is saying that they're off balance or that they are not steady because that's putting them at an increased risk of falling, which is what we want to prevent. In the morning time, our bodies are still waking up from sleeping. So, there is that aspect of still waking up and maybe our vision isn't quite awake as much as it should. So our balance might be a little bit off in that time of the day and get gradually better as the day goes on. Some things to kind of consider is taking a minute when you're sitting up from the bed and just making sure your body is awake and ready to stand up will be helpful for you, and also making sure that there's nothing you could trip on right from standing up out of bed. So, no shoes that are by the bed or throw rugs, anything like that, just to prevent any kind of falls from standing up out of bed and starting those first couple of movements.
Yeah, when patients come in with dizziness or balance issues, there's a lot of different things that can cause dizziness and balance issues. So we have to kind of do what we call a differential diagnosis. So we start to eliminate kind of things that might be causing that. What I will say is if you get up in the morning, you feel like the room is spinning, that's very specific to positional vertigo, which is something that we treat a lot in our office. So if that's the case, they would get a different kind of set of treatment versus someone who gets up and says, well, the room's not spinning, I'm just kind of lightheaded and I just don't feel steady. This is probably something new. She hasn't been, getting up for years like this, so something new that she's dealing with. But we need to find out why she's having those balance issues. It could be something physical therapy related, meaning neuromuscular or vestibular, but it could also be something medically related. There might be some imbalances in hydration. There might be some issues with new medications. Unfortunately, if you guys go home and read your medication bottles, a lot of the side effects of some medications are dizziness. And when you combine them, then you can like throw everything out because combinations of medications are hard to predict exact side effects of that. So I guess the answer to the question is we got to find out why that is. And if it's was like a couple days and it went away, we'd be like, maybe not something you have to worry too much about. I would try to hydrate a little bit better, make sure you're getting enough calories on board. If this has been going on for a while, someone needs to check that out. In physical therapy, what we would do is a free screen, and we would run you through some vestibular tests probably to rule that out, and then try to find out what's causing that. If it's a neuromuscular issue, that's something that we can easily address in physical therapy, which is the next question that we have here from Deborah, which says, "Are there exercises to prevent falls as we age?" She already knows that falls are bad. So if you've been treated by me and you have a falls problem, you've heard from me. If you're over the age of 65 and you fall and fracture your femur, there's a 30% to 40% chance you're going to die from that injury in the next 365 days. So we, just like Brianna said, we need to prevent falls before they become a bigger problem. When you have someone that says, "Hey, I know my balance is bad. I haven't really had any falls, or maybe I've had a few falls, but nothing bad happened. Nothing. Don't worry about it." What are some exercises that you would generally give someone that says, "Hey, what can I do to improve my balance?"
Yeah, so it also depends on the um the systems that are impacted in balance. So for balance, there's three different systems that contribute to your balance. Your vision, so how your eyes are able to adapt to the world around you to see where you are. Proprioception, which is your joints' ability to figure out where the heck they are in space, and then also your vestibular system. So that's your brain's ability to kind of balance you out and allow you to reach an equilibrium status. So during a free screen or a PT evaluation, we would kind of deduce what would be most impactful to the individual, and tailor exercises based on the findings. Now, in general, most people don't fall just standing still. So we want to do dynamic balance. So more so working on, not just standing in a certain way and statically holding that stance, but standing in a certain way and then moving in that stance. Or if we're finding ourselves more unstable when we're stooping or squatting, things like that, kind of go based on what is more provocative for you, because most likely if you're going to be falling, it's not going to be when you're standing still. But in the other sense, with balance, and when you do have that risk of falls, you want to be safe in your environment and make sure that there's something to hold on to or to prevent any kind of unsafe circumstances when you're working on balance.
Yeah, when you come in for physical therapy, we're going to test you in terms of if you're having balance issues, you better be losing your balance in therapy, which might sound counterintuitive. The big difference is we're right there when you're losing your balance, so we can kind of correct for any kind of issues you might have. You don't fall in physical therapy. So that would be the concern that Bree's talking about. Is, yeah, I mean, really, you're trying to get your center of gravity outside your base of support. So if you were to stand on one foot and take like an object and try to put it as far away from you as possible on the kitchen table, the further out that object gets, you'll find if you do it, the harder it is to maintain your balance. Doing that at home is something you should definitely do, but also be safe about it. There's got to be something near you so that if you do kind of partially lose your balance, we tell people to put their foot down, but certainly you should be able to grab onto the table or something near. If you fall while doing this exercise, that would be a really bad thing. So it depends on how bad your balance is. Obviously, all the patients that we have that we see with balance issues, we give them homework to do because the 2 to 3 hours that you spend in physical therapy is really important. But there's many other hours during the week that you're not in physical therapy that you have to work on this stuff. And people will typically say, "Well, I'm old. My balance is supposed to get bad." It is common that balance deteriorates as you get older, but that's not what's supposed to happen. Balance is a skill, just like learning the guitar or piano or pickleball or anything. If you practice it, it will get better. And I think that's the most important message that people can have coming away from this conversation. So thanks, Brianna. Thanks for answering the questions. And we'll see you guys on the next episode.